Welcome. My name is Tony Russell, and in this module I will be discussing one of the more challenging issues in new product planning, knowing when to kill a program. The views and opinions expressed in this presentation are solely mine and do not represent those of my current or previous employers. In drug development, there are a number of scenarios that can come up that can create challenges. For example, significant toxicity issues can arise, or a study fails to reach statistical significance on a primary endpoint in a trial. In these examples, the clear approach is to stop the program. However, what if the program is currently entering a crowded market with no clear advantage, or the program is technically feasible, but the timelines put it far behind the competition, or development timelines are longer than expected compared to other programs in your portfolio? In these examples, there are a number of approaches, including pivoting to a new disease, or collaborating with an external partner for extra resources, or a decision needs to be made to stop the program to conserve resources. For this module, we'll discuss why it is important to stop programs that might be potentially weak. So what makes a weak program? As you can imagine, there can be many factors that can define a weak program. For this module, I will focus on three key factors. First, the value proposition is not well defined. If it is unclear what problem is being addressed for the patient, physician, or payer, or all three, then there could be a problem. Another way to look at this is what treatment gap is being addressed. If the answer is unclear, then there could be an issue with the strength of the program. Another aspect of a weak program is that it is a late entrant into a crowded market with effective options. If there is no clear differentiation, then the ability to obtain significant market share will be greatly impacted. And if there is no clear competitive advantage, then this is another key sign of a weak program. Be careful if teams rely solely on mechanism of action as a competitive advantage, unless it can be translated into meaningful outcomes. And be especially careful if teams rely on hope as a strategy. Hope the competition will fail, but your program will not. Hoping the program will somehow perform better than expected. Hope is not a strategy, and this could be another sign of a weak program. Let's discuss why it is important to kill a weak program. There are many costs for keeping a weak program going. First, costs start early in a program and accumulate quickly. By consuming costs, a weak program can deprive stronger programs of needed limited resources. In essence, the weak program can starve stronger programs. By keeping a weak program going, there's a risk of cumulative selection bias. That is, the situation of, I've been working on this program for so long, so it must be good. And not electing to stop a weak program early can eventually drag down the value of the company and risk credibility as an innovator company. If this seems so clear, then why aren't weak programs stopped? There are many reasons, as you can imagine, and these can include adhering to the idea of the underdog winning against the odds, and team members are likely to point to anecdotal stories of programs that succeeded, but ignoring the multitudes of failures. There's also the issue of rewarding short-term behaviors at the cost of long-term objectives. And of course, there is the natural fear of failure. Related to the reward system, there can be a disconnect on the day-to-day decisions given the long time horizon in drug development, which can span 10 to 15 years in some cases. And another key reason why programs are not stopped can be due to avoiding doing the critical studies or analyses to address important critical issues within the program. Let's discuss some approaches that can provide an objective review that can help determine the strength of a program. It is always a good idea to conduct qualitative interviews with external and internal experts regarding the landscape, unmet needs, and the perspective of the program. Key to the evaluation of any program is to have a deep understanding of the competitive landscape. Using analytics of prescription and sales data can provide an important and objective view that can be quite valuable. And the use of PTRS and risk-adjusted NPV can be highly valuable when dealing with a portfolio of programs and you're looking to review the strengths and weaknesses of each program. We'll go through each of these in more detail. The key to doing qualitative interviews is to limit bias as much as possible. Remember, the goal is not to reinforce preconceived concepts, but to obtain critical feedback. Before conducting the interviews, it is helpful to spend time on developing the discussion guide. Never go into an interview without one. When developing the discussion guide, be sure the questions are not being asked in a leading way and use open-ended questions as often as you can. Most often, qualitative interviews are focused on external experts, but it can also be quite helpful to talk one-on-one with internal stakeholders. This can help to uncover any hidden issues and be instrumental in building internal advocacy. It is not uncommon in new product planning where your program may be behind the competitors, such as was illustrated here. In this situation, understanding the specifics of the competitive landscape can be helpful as the teams think through development and positioning options. This is where competitive intelligence comes in. I've listed some example key intelligence questions that are commonly used. Some information may be available through secondary sources, such as clinicaltrials.gov. Others may not be, so primary CI can be a viable option. I've listed some best practices in CI here, and this includes asking specific questions built from specific needs. Also, be sure not to use competitive intelligence as a replacement for market research, as these are different methodologies. And spend the time needed to develop the key intelligence questions and key intelligence topics with relevant internal stakeholders. Be sure to engage with CI firms with the right skill sets. Some are better at some approaches than others. And be sure to educate internal teams on the difference between information, which is bits of information, and intelligence, which is more of painting the picture. Another approach that can be helpful in evaluating a program and the landscape is prescription data analytics. This is a case example where the team wanted to pursue a program that could take advantage of a growing class of drugs. However, a new technology was recently introduced. So we wanted to understand how the new technology impacted the need for the therapeutic class the company was interested in. In this example, we confirmed that the patient population was increasing as expected. We then looked at prescription volume trends and not sales trends, which can be influenced by price changes. We noticed that the introduction and widespread adoption of the new technology was associated with a deviation in prescription volume from what was predicted. This information helped the team to make a decision to not pursue this program given the changing landscape. A common approach to use from a portfolio perspective is to evaluate programs based on probability of technical and regulatory success, or PTRS, and risk-adjusted net present value, or RNPV. PTRS allows you to account for the risk of programs based on their stage of development. Earlier stage programs tend to have higher risk than later stage programs. An important aspect for PTRS is to use data specific to the program's therapeutic area, if possible. Analog data can be used as a substitute if needed. The PTRS data can be used to determine risk-adjusted NPVs for each program. You can also look at value inflection points for each program at each stage of development. This can be important when looking across programs to determine value generation points and to help rank order programs. Now that we've reviewed some example approaches to objectively evaluate a program, the next step is to build an integrated view. This includes reviewing the expert advice along with the insights from competitive intelligence. The patterns from prescription analytics will be helpful, as well as any assessments from PTRS and risk-adjusted NPV calculations. As part of the review, it can be helpful to consider the following questions in the situation where a program could be objectively seen as weak. Is it possible to correct for any identified deficiencies to help strengthen the program? Are there other opportunities to be explored with the asset, such as other indications, other formulations, or other options? Would a partnership help overcome some of the identified deficiencies? And are there better investments to be made in other options in the product portfolio? Addressing the issues of a weak program can be extremely challenging. It is important to spend time needed with the teams to work through the issues and evaluate options. As we've discussed, the topic of killing a program in new product planning is a difficult one, but it is important to be prepared as the situation is likely to arise in any company. It goes without saying, it can be extremely difficult to discuss the idea of stopping a program. Be prepared. Also, be aware of potential decision-making errors. There's a type where there's the risk of ignoring evidence that might challenge certain assumptions that a program will succeed. There's also the other type of terminating a project prematurely for lack of evidence that it could succeed. It's also important to use what's called truth-seeking behaviors early in the process. It's also important to quantify and communicate opportunity costs within the organization. And redefine what it means to be a success or failure. Progressing a marketable program or terminating an unmarketable program are both successes. And incorporate a quick win, fast fail drug development mentality. And have regular predetermined periods of evaluating programs. And remind the team that the goal is to have programs with the strongest chance of success that will build value for your organization. I hope you found this module helpful. Please feel free to contact me via LinkedIn if you have any questions, and feel free to leave comments below. Thank you.